So this is our flag person, Destiny. Whenever you see a green flag, it will be 5 minutes. A pink flag, it will be 2 minutes. And then if it's red, then please stop. Our first presenter will be Miss Laura Goldby. You can come up, please. This, yeah, perfect. Probably the one that says your name, right? Okay, hang on.
You're just here for her.
Yes.
Gotcha.
How do
Will you
we
get this one?
click the channel? Oh, you got it. Yes, let's make sure that we're not muted. That's our biggest thing. So just stand right here, and then at the end, if people ask you questions, then you've got to repeat what they say and then respond, please. Okay. Sorry.
Hi, my name is Laura Goolsby, and I am a senior nursing student here at Piedmont. My capstone project is over complementary and alternative medicine practices with cancer treatment. My research question is, do complementary and alternative medicine practices reduce symptoms associated with cancer treatment? So what is cancer? Cancer is a disease of abnormal cell growths or tumors that can spread to other body parts and wreak havoc on the body as it goes. So some treatment options are chemotherapy, radiation, and surgery. There are many side effects of conventional medicine practices, such as chronic pain, nausea and vomiting, constipation, anxiety, depression, edema, appetite loss, and fatigue. Complementary and alternative medicine practices are also known as CAM therapy. They include herbal medicine, traditional Chinese medicine, aromatherapy, and relaxation techniques. These methods can be combined with traditional treatment. There are many benefits, including a majority of the treatments have no risk factor and they're relatively cheap. And then there are negatives, such as a risk for toxicity. My first research study was evaluation of traditional Chinese medicine herbs in oncology clinical trials. The purpose of this study was on traditional Chinese medicine herbs and their use in oncology clinical trials. So a history of traditional Chinese medicine, it's also known as TCM, and it includes herbs, acupuncture, mind and body practices, and other therapeutic approaches. People have been using TCM therapies for over the last 2,500 years. The participants of this study were from a nationwide medical insurance data analysis of 51,382 cancer patients. My study findings were that 42.4% of Chinese cancer patients used TCM herbs, and 24.8% of the Chinese cancer patients use these herbs in combination with conventional oncology drugs. 20% of US cancer patients use TCM, and then 40% of Americans believe alternative medicine can cure cancer. So results, future research needs to be conducted, and conducting high quality clinical trials, we can move the use of TCM herbs from empirical based practice to evidence-based practice medicine that benefits millions. My next study is discovering the use of complementary and alternative medicine in oncology patients. It was a systemic literature review. The purpose of this study was to address the use of complementary and alternative medicine in oncology patients and how it should be applied to the nursing practice. This included 12 research studies with 4 studies from Asia, 3 studies from Arab countries, 2 studies from Canada, 2 from Europe, and 1 study from South America. Some common CAM products include minerals, vitamins, herbal products, honey, and Chinese medicine. So some study findings. The most common person to use CAM therapies was a married woman over the age of 40 with a moderate income. Some studies showed that males were more likely to use these, and some showed that females were more likely. The average income level varied from study to study, and married individuals were more likely to use CAM. 25% to 80% of study participants used CAM therapy for management of their symptoms during cancer treatment. The patients used CAM therapy for various reasons, but they all used it because they thought it would help their recovery. Many used it for emotional well-being, improving their immune system, controlling pain, improving appetite, and increasing their body's capability to fight cancer. Some were just willing to try anything to beat cancer, so they tried it. They did have a high satisfaction rate overall. My third clinical trial was over Chinese herbal medicine for symptom management in cancer palliative care. The purpose was to discover if Chinese herbal medicine, known as CHM, is effective in symptom management. This was a systematic review with a meta-analysis and included 14 randomized control trials from 2006 to 2013 in the mainland of China. The study findings were that with pain, combining conventional treatment and CHM significantly reduced pain scores compared to conventional treatment alone. For constipation, conventional medicine and CHM was comparable. With anorexia, there was no improvement in symptoms, and with fatigue, CHM had a positive effect. So results, there was a positive experience with CHM products as an add-on during cancer treatment and an alternative to conventional medicine in reducing many symptoms. My fourth study was usage of aromatherapy in symptom management in cancer patients. It was a systematic review. The purpose was to see how aromatherapy affects the symptoms of cancer patients. This included 12 randomized control trials, and data was collected from interviews and questionnaires. So a history of aromatherapy. People started using it approximately 5,000 years ago in the Middle East and Egypt. People now use them through inhalation and topically. Typically, they try to use aromatherapy to improve their quality of life and reduce side effects of cancer treatment. So some study findings. Linalool oil, which is found in lavender oil, reduces pain. In pediatric cancer patients, it was found that essential oils reduce pain and anxiety. And then massaging lavender oil on colorectal cancer patients reduced anxiety and increased sleep quality. Ginger essential oil decreased nausea and vomiting, and then a combination of lavender, peppermint, and chamomile oil reduced general symptoms and increased the quality of life. Some results. So, aromatherapy is a safe method for symptom management. It was found that people use aromatherapy differently. Some may use it to massage it on their body, while others prefer a diffuser for inhalation. This intervention is safe and is easily applicable and has no complications. My fifth study. The purpose was to find evidence on herbal medicine and clinical effects of herbs in cancer care. It was a review study. Some examples of common herbs are ginger, turmeric, basil, rosemary, cloves, fennel, coriander, and garlic. So my study findings. 60 to 80% of cancer patients use some form of herbal medicine. Ganoderma lucidium is a mushroom commonly used to enhance the immune system. It activates macrophages, T lymphocytes, and natural killer cells. Sophora flavicinis increases leukocytes and causes the peripheral immune system to respond. And then some herbs are chemopreventative herbs such as ginseng and Carthamus tinctoris, which is used for breast cancer patients. The periwinkle plant also produces vinca alkaloids, which are isolated and then given IV for anti-tumor activity. So the results. The evidence shows that using herbal medicine along with conventional treatment treats the whole person and is positive for the patient. 70% of the world cannot afford cancer treatment. Herbal medicine is cheaper than traditional cancer treatments and can treat and prevent cancer. So a synthesis of the literature. Outcomes. For those who use chemotherapy and conventional cancer treatment, there was a decrease in nausea, vomiting, constipation, anxiety, depression, sleep problems, and chronic pain. There are some setbacks though. Most providers do not encourage the use of these products, and many cancer patients do not know the benefits of such products because of that. There is a risk for toxicity, and in the future, research needs to focus on specific herbs, relaxation techniques, and Chinese medicine practices that would benefit the population. For nurses, there needs to be education on contraindications of using certain products together, and they need to be aware of what's asked the patient. Education on complementary and alternative methods in general needs to be done for nurses as well. In conclusion, complementary and alternative methods can improve outcomes of those with cancer who already go through so much with chemotherapy, radiation, and surgery. The side effects experienced by cancer patients typically impact compliance and their willingness to continue going to treatments. It has been shown that complementary and alternative methods reduce the symptom load and improve the quality of life. Research in the future needs to focus on how to integrate these practices into conventional care and educate healthcare providers on how to use these products. Those are my references. Are there any questions?
Lauren, what do you see as the major blocks to integrating this into practice? Were you able to see that in your research?
Yeah, I was able to. I think the majority of it was that healthcare providers do not encourage it, and many healthcare providers are not taught this in med school. For example, they are taught one nutrition class while they're in medical school. So they don't go over all of the alternative methods or anything like that. So
you attribute that to just lack of knowledge?
yes, and they're not taught that. So yes, ma'am.
Laura, can you please repeat the question?
Oh, sorry.
No, it's okay.
The question was, what was the question specifically? Sorry.
What are the blocks to integrating this into practice?
The question was, what are the blocks to integrating this into medicine?
I have a
Yes.
question. Would this be like a culture thing? Because I know you listed countries like outside of the United
Yeah,
States.
so a lot of other countries are already integrating this into medicine because as they're brought up, they are introduced into this. America, typically, they don't use herbal medicine a lot, except in like some southern, like Appalachian areas and different things like that.
You're already on it, aren't you? Okay, so now we have Miss Priya Desai, and let's pull up your presentation, please. Right here? Yes.
I'll just go.
You sure?
Yeah, that's fine. So I'm Priya, and I'm currently a senior nursing student here at Piedmont University. And my presentation project is about what is the effects of a global pandemic on psychological disorders in healthcare providers. So we have all been affected by a pandemic in one way or another, with the biggest example right now being COVID-19. But what does the word pandemic mean? The World Health Organization notes that an epidemic is considered to be a regional outbreak of an illness that spreads unexpectedly, and that a pandemic is a worldwide spread of a new disease. Pandemics are considered to be public health emergencies, and some of the most notable ones are the 2009 swine flu pandemic, the HIV and AIDS pandemic, the 1918 Spanish flu pandemic, and currently the COVID-19 pandemic. These can all cause sudden, widespread morbidity or mortality, as well as social, political, and economic discourse. Although as pandemics continue to come and go, what impact is being placed on our healthcare workers? With pandemics comes fear of the unknown, shortages of resources for both testing and treatment, uncertain prognoses, and possibly even emotional distress and an increased risk of psychiatric illnesses. Healthcare providers play an important role in pandemic responses, and these public health emergencies may affect the health, safety, and well-being of these individuals. Some issues that may occur that can include confusion, emotional isolation, PTSD, depression, and anxiety. Therefore, the purpose of this multi-literature review is to understand the underlying mental health effects placed on healthcare workers during global pandemics to prevent the reoccurrence of similar incidents. So my first article is titled "The Psychological Impact of Epidemic and Pandemic Outbreaks on Healthcare Workers." This article, the purpose of this article was to provide quantitative evidence of psychological effects by reviewing 44 studies that covered the SARS, MERS, COVID-19, Ebola, and the influenza epidemics and pandemics. This article explored studies in multiple different countries, including but not limited to China, Canada, Taiwan, South Korea, Saudi Arabia, Greece, and Nigeria, etc., to ensure that there was a broad geographical outreach. Furthermore, the limitations of this study include that due to the rapid nature of the literature review, the authors were unable to provide a quality of reporting evaluation of the 44 included studies. If this would have been performed, it would have provided a deeper understanding of the present results. The limitations were due to the fact that the number of longitudinal studies were limited, and the majority of studies included were retrospective studies. So that means that they were from a few years ago, but if it was right now, it would have been like more current. The data would have been more current. My second, and as you can see from those statistics, the greatest one was the high levels of work-related stress, which were already under a lot of stress as healthcare workers, but that was up to 80.1%. My second article was titled "COVID-19 Pandemic and Mental Health Consequences." This was a systematic review to analyze the literature to provide an overview of psychiatric complications secondary to the COVID-19 infection, the direct effect, and how COVID-19 is currently affecting the mental health among the general public and psychiatric patients, which is the indirect effect. So this looked at healthcare workers as well as the patients that are currently going through that have COVID-19. And a total of 43 studies were included in this review, and 2 of the studies investigated mental health issues in individuals with COVID-19. The initial search for studies resulted in 460 articles. An additional 4 papers were identified from the references and the reviews from the search. Overall, most of these studies were conducted in Asia, and 4 of these studies were conducted in Europe. So I believe that one of the limitations of this study was that they did too narrow of a search, since it was only in Asia and Europe, and they didn't take into account all of the other places that pandemics can occur. So this one had levels of post-traumatic stress syndrome were at 96.2% among the patients during hospital admission, which is far greater than the general public, which is at approximately 7%. Article 3 was titled "Factors Associated with Mental Health Outcomes Among Healthcare Workers," and this was a cross-sectional survey-based region stratified study. And here this article was actually in China itself, where COVID originated in Wuhan. And it collected demographic data and mental health measurements from 1,257 healthcare workers in 34 hospitals in 4 days. And there were many strengths from this study. One was that there was a high number of selected participants. There was, like I said, 1,257, and 764 of them were nurses. And depression rates went up to 50.4%, anxiety was up to 44.6%, insomnia was at 34%, and distress in general was up at 71.5%. My fourth article is titled Psychological Impact of Deploying in Support of Ebola. So this was not about COVID, but instead about Ebola. And this was a systematic review and meta-analysis to examine the potential psychological impact of deployment in support of the US response to Ebola in West Africa. So this was this studied the troops that were sent out to help with the Ebola cases. And while scientific literature has already addressed the psychological impact of exposure to virulent pathogens among healthcare workers, no known studies have been performed to investigate this among service members or regarding the Ebola outbreak. This study does not mention the COVID-19 pandemic, but still covers the Ebola pandemic that occurred from 2013 to 2016. And this virus was spread through contact with bodily fluids such as blood, and symptoms included fever, chills, muscle pain, and headaches. And this pandemic killed approximately 11,000 people and was considered the most widespread outbreak of a disease in history and caused major loss of life and socioeconomic disruption in the region. And it was predominantly in Guinea, Liberia, and Sierra Leone. And in this one, deployed service members may return with clinically significant problems, most notable of which was depression, and the severe levels or average rate was at 46%, and severe levels of depression was up to 9%. My fifth article was titled Mental Health of Clinical Staff, and this was a rapid review and meta-analysis, and it was aimed to estimate the additional burden of work on frontline healthcare workers. So like I said, we already as healthcare workers are under quite a bit of stress, so pandemics just make it worse. And this shows that there was not a significant increase in all mental health problems for frontline workers in pandemics. There is still an increase in depression, which could lead to suicidal ideations and even death, which did support my clinical question. And the synthesis and discussion of literature. There were many commonalities seen amongst all of the articles that were studied on the effects of global pandemics on the psychological disorders. And to synthesize this information, there's a consensus that healthcare workers who have worked in a pandemic do have increased levels of mental health disorders. And most of these psychiatric issues are anxiety, depressions, and others included PTSD, insomnia, and alcohol and drug misuse. And overall, this paper brings to attention increased mental health rates in healthcare workers and shows that there is still a large need for intervention that should be implemented to enhance nursing practices for the overall greater good, not only for the healthcare workers, but for the patients that we're taking care of and their families. And some of the interventions that we can include are proper mental health training, mental health screenings, provide therapy 24/7 because some people work night shifts, some people work day shift, meditation, as well as medications for depression, anxiety, and stress. Do you guys have any questions? Yeah.
So in your articles, did you see anything in correlation with however long the pandemic went on? Did that increase any percentages in mental health disorders?
I didn't personally see anything because a few from all over. I picked Ebola, and I think the swine flu as well as COVID. And I think it was more of the lack of resources that went into it. And if there were more a lack of resources, people were already under stress and there was no one else to help, which kind of what we are in now, that led to more stress levels.
Will you repeat the question, please? that she asked.
I'll say it.
No,
Was
okay.
there like any correlation between the percentages and time?
Was there any correlation between the percentage and the time of pandemics and stress levels?
I have a
Yes.
question. Did you notice any like statistics for people leaving employment for that reason?
I did not.
You can go ahead and just repeat it right after that. Say it.
Oh.
Makes it easier.
Was there any correlation between,
Like people like with their like, with depression and mental illnesses with them leaving their employment because of that?
with
Was it
mental
just-
illness
Yeah.
and people leaving their jobs because of that? I did not see any in that, but I would assume that people do leave. And I think that we've seen that with the COVID-19 pandemic, where people are leaving their staff nursing jobs and are going to travel because they offer more money or they don't have as much stress and they don't have to see, I mean, they probably still do see COVID, but they can kind of choose, do I want to go somewhere that has less cases of COVID, or do I want to go back to Atlanta that has tons of cases? So I think that does play a role in it. Any other questions? No. These are my references.
Up next, we will have Christopher Burke.
George, this one. Just remember when people ask you questions, just say, because they would have.
Okay.
So my presentation is COVID-19 transmission reduced with N95 respirators in comparison to surgical masks within healthcare professionals, and it's presented by me. So the background, the ongoing pandemic of COVID-19 has impacted every individual life, leaving healthcare workers at the forefront to defend, protect, and treat increasing cases of COVID-19 positive patients. And it was necessary to review the best forms of PPE for healthcare workers, especially during patient contact. COVID-19 is a contagious disease, as many of you may know, and its respiratory symptoms may include fever, cough, headache, fatigue, respiratory distress, and loss of smell and taste. Studies suggest COVID-19 is transmitted when people inhale contaminated air droplets and airborne particles containing the virus. So my first article title was Medical Mask versus N95s, Respirators for Preventing COVID-19 in Healthcare Workers, a comprehensive systematic review and meta-analysis of randomized control trials. And so a systematic review is basically a bunch of research compiled into one to create a systematic review. And the purpose of this was to compare medical masks to N95 respirators in preventing laboratory confirmed viral infections and respiratory illnesses, specifically in healthcare workers. So this wasn't done on the public, but anyone who was a nurse, doctor, tech, LPN, or things of that nature. So the results concluded the use of medical masks did not offer protection against viral respiratory infections during non-aerosolized environments. Preservation of N95s for high-risk areas should be considered. So what is non-aerosolized environments? I should talk about what is. So sneezing, that would be an example of aerosolized environments. CPR, doing a tracheotomy, surgery in a surgical room are all examples of aerosolized environments. And what they're saying is basically for those type of things, you should wear a N95 instead of a medical mask. So the limitations was indirectness and imprecision of available evidence. And during this study, it was conducted in 2020. And so during that time when COVID was out, the accuracy of swabs was at 100% accurate. And so there was some differences in positive versus negative results. Second was, this was a meta-analysis of an aggregate population rather than individuals. And so again, it was looking at the population rather than individual basis. So the second article title, Surgical Mask for Protection of Healthcare Professionals Against COVID-19. This too was a retrospective observational study. And the purpose of this was to, aim the study was to evaluate the use of masks among healthcare professionals exposed to COVID-19 positive patients. The results revealed a higher infection rate in those healthcare professionals who had partial use or no PPE. This included not wearing their mask correctly, wearing it below the nose, or not wearing one at all, such as masks, gloves, and hand washing. Surgical masks proved to be slightly effective in protecting healthcare workers against COVID-19 and public clinical settings. So limitations of this study was the chances of the patient or person being asymptomatic not being able to be detected. And secondly, the initial exposure to COVID may have arisen outside the hospital setting. And so for this study, there was no guarantee that the positive patient have contracted COVID in the hospital. It could have arisen outside. So the third article study was comparative effectiveness of N95 respirators and surgical masks and preventing airborne infection in the era of COVID-19 pandemic. So this one was a meta-analysis of randomized control trials. The purpose of this was to reveal the relevant and publish randomized control trials with the aid of meta-analytic methods. The results revealed respiratory illnesses and influenza-like illnesses were less frequently observed with N95 respirators, despite conflicting articles. So for this one, there was some contradictory evidence saying that medical mask does work and other articles saying that it does not work. But for this study, it was more than just COVID they looked at. They also looked at flu and mumps, measles, and rubella, and anything that's viral and it can be transmitted. So the limitations for this one was it involved at least a moderate risk of bias, specifically in the type of face mask given to participants in the study. And so this was basically giving the participants options to choose, do you want an N95 mask or a medical mask? And being that most people know that N95 masks are more durable, they would choose that instead of looking at the medical mask. So my fourth article was mask or N95 respirators during COVID-19 pandemic. Which one should I wear? And this was an observational study. And so this wasn't too focused on the statistics, data, and meta-analysis of other studies compared to other studies. The purpose of this was to analyze the selection of facial protection for preventing viral transmission of COVID-19. The results concluded that N95 respirators are highly preferred for high-risk procedures when aerosolized production is likely or when the COVID-19 status of a patient is positive or unknown. Again, and that's just good safety measures to take whenever you're dealing with a patient who has COVID. Just like how we got fit tested with the N95 mask, taking that good preventative measure to wear N95 when dealing with a positive patient should be done. The limitations for this one was they appeared that the efficacy of accurately measuring aerosolized production. And so for this one, being that it was an observational study, measuring viral particles in the air was hard to do. And so there was no guarantee saying that the person contracted at least one or two viral particles and saying that the other one didn't. And so that was the only limitation for this study. My fourth article, or I believe my fifth article, the health policy perspective to protect healthcare workers during COVID-19 pandemic. It was a grade rapid review on the N95 respirators and effectiveness. So scientists explored the best forms of PPE in the clinical setting, and the results concluded wearing N95 respirators can prevent 73% of infection rates for every 1,000 people compared to surgical masks. And actually, when I was doing this study, I found that medical masks can protect you from bacteria, not viruses, compared to N95 mask that can protect you from both. So limitations for this one was that the source of infection, community rather than the workplace, and it cannot be ascertained in any of the trials. The mortality rate among healthcare workers should be related to the infection rate. And so for this study, when it was conducted, they only included living participants in the study. Living participants in the study and not factor in the death rate from COVID for this one. So here's some facts. N95 means non-oil with 95% efficacy. And so when wearing a N95 mask, it's best not to wear makeup because that's oil-based and it can actually destroy the durability of the mask. Second, KN95 masks are actually made in China, and they do not meet American standards, and they are not FDA or CDC approved. So why do we use them? We use KN95 masks because, for one, they're cheaper and they apply to international standards, not just not towards America, but international standards. 3, a COVID-19 particle is 0.125 microns, and an N95 protects from 0.06 to 0.14. And so it's just right in that range of a COVID virion. 4th, a medical mask are hydrophobic, so they repel against water droplets like blood and bodily fluids. And the last one, a recent study I was doing revealed that wearing a face mask can increase your susceptibility to contracting COVID-19. And the only reason of that is because most people who wear masks tend to touch their face more often. So what does the WHO and World Health Organization recommend, and CDC? Here's the first two are just common definitions of what masks are, but they recommend using N95 respirators for protecting against COVID in non-healthcare settings. N95 respirators should be prioritized for healthcare personnel and for other workers who are required to wear them for protection against other hazards. And how is this relevant and prevention? The general public is recommended to wear medical masks and to keep a 6 feet distance. Healthcare professionals in clinical settings such as dentistry, hospital, or surgery should be suggested to wear N95 respirators. Partial use and or limited use of N95 masks are not effective. Again, and that's just wearing it properly and not having it below your nose. Make sure it's properly fit tested. Continue to social distance despite wearing a mask or PPE. And I think that's one of the things we tend to lack on, even myself, that we don't social distance as we should. And the last one is, I don't know if that word is blocking it, but does not guarantee 100%.
I think it's vaccination.
Vaccination?
Yeah, I think.
Oh yeah, I think you're right. Oh
Yeah.
yeah, you're right. Vaccination does not guarantee 100% safety. And so many of us are vaccinated, and just because we are, that does not mean we're protected from contracting COVID. We still are able to contract and become COVID positive. So to conclude, what I learned from this study was that the research articles provided demonstrated support and belief of N95 reducing COVID-19 transmission in comparison to medical masks offering less protection against viral aerosolized particles. And I just want to add on to this. So that's not to say that I should wear N95 more often. I should wear a medical mask. But when you're in those type of environments like the hospital, close contact to a patient who is COVID positive, then yes, you can wear N95 mask. These studies included influenza, COVID, and viral respiratory illnesses. Depending on the environment, research suggests wearing a medical mask for preservation of N95 respirators. And to continue these practice, proper education for patients is highly encouraged. And any questions?
I don't have a question.
Yes.
But I read this article, and researchers at the University of Birmingham posted this thing about how they found a like a liquid that kills COVID, and they actually put it on the air filters. So like you said in your 4th article, that it's an airborne virus, and so it was going through the air vents, it was killing it. So initially it was not even like, it was stopping the transference of the disease, which I thought was pretty cool.
Oh, that is cool. Thank you for telling me that. And that's my references.
Our next presenter will be Caitlin Worthy. I can scroll.
No, I don't mind.
All right, good afternoon. My name is Caitlin Worthy, and today I'm going to be talking about, does adequate sleep improve academic performance? So these are the topics I'm going to be talking about. The first thing I'm going to be talking about is the importance of sleep. The second thing I'm going to be talking about is our bodies without sleep. And then I'm going to be talking about how inadequate sleep affects our bodies both physically and mentally. So this is the format I used to develop my research or my PICO question. The P is patient or population, which is college students. The I is interventions, which is adequate sleep before exams. The C, I didn't compare it to anything, so it's comparison, so none. And then the outcome is improve academic performance. So the importance of sleep. So sleep is very important for our overall health. Before I begin, with a show of hands, if you could describe one word of how you feel when you don't get enough sleep, what word would you choose?
Annoyed.
Annoyed. Okay. Anyone else? Yeah.
Confused.
Confused. Okay. So with the proper amount of sleep, our energy is increased. It helps with our cognitive function. It boosts your immune system and your mood is better. So yeah. So most of us in here are adults, or all of us. So 7 to 9 is per night is what we should be getting. Without that, you have decreased alertness, impaired memory, you forget things more easily, and you're at an increased risk for diabetes, cancer, and stroke, and you're accident prone, so you're more willing to make more mistakes throughout the day. So when I was conducting my research, this is what I found interesting because this is how sleep affects our bodies physically. We can actually gain weight not getting the right amount of sleep. So in 2020, an analysis was done by the National Institutes of Health and found that adults who sleep fewer than 7 hours a night had a 41% increased risk of developing diabetes or obesity. The reason of this is because there's two hormones in our body. We have Greelin and Leptin. Greelin makes our bodies feel hungry. So when we're sleep deprived, this hormone is increased, and leptin makes our bodies feel full. So when we are sleep deprived, this hormone is decreased. So that makes us eat more, we're overeating, and our body's craving those more sugary foods, not making us feel full. And this leads to obesity, and which can lead to diabetes and stroke and cancer, or not cancer, but you know. So now with the academic performance, with saying that sleep decreases cognition and memory and focus, one of the studies that I found entitled Sleep Pattern Disturbances Among Undergraduate Nursing Students and the Association with Their Academic Performance. So mainly my articles focused on nursing students and how we stay up and we study, but are we actually comprehending that type of information, and how is that affecting our academic performance? So in the study, the results showed that there's a significant negative correlation between academic performances and sleep disorders. This study used the ESS scale, which basically asked questions to the participants about daytime sleepiness. So the higher the score, the more it was associated with students who felt sleepy throughout the day, they were tired during lectures, and it decreased their academic score. So to tie it in with cognition. So has anyone ever stayed up the night before exam to cram, or done an assignment late at night? Yes. Okay. So I know from personal experience last semester, I would stay up the entire night, would not sleep, and go in, take my exam. And after, I was just in a brain fog. I did not remember anything. I slept the whole night, and so it just wasn't good. So I am a person who chooses to neglect sleep and study the night before. And I found in this article, it supported my PICO because it revealed that the amount and quality of sleep throughout the night have a major effect on cognitive functions during the following day's activity. Now that I've researched this, I can see that like sleeping the night before actually helps, and I figured out that I comprehend more and I'm able to just remember the information. Now, sleep is very difficult to achieve just because we are college students, and I know some of us work on top of being a college student, so that's a job, and insufficient exercise, daytime naps, homework, and exams. So these are just a few things that can help when it comes to trying to sleep better throughout the night. Plan a schedule to do your homework and stick to it. The key with this is just to be consistent with it. Don't consume caffeine late in the day. Reduce irregular or daytime naps. So they recommend like 45 to an hour if you're going to take a nap, and you should be able to sleep throughout the night with that, and try to exercise regularly. So when I was also doing my research, I found that since I am a nursing student, how important sleep is going to be for me in the future as a healthcare worker, just because nursing is that profession that requires critical thinking. It requires the ability to focus. You know, we're giving meds. We have to make sure that we're doing the math right. We have to make sure that we're giving it to the right patient at the right time. And with the lack of sleep, that can affect our patients greatly in their care. So we must pay attention to detail and stay concentrated in the task that we perform. And not only is sleep just important for, you know, healthcare, but just like in everyday life, driving, you know, just those stuff that we do every day that we don't realize that sleep can affect. So in conclusion, not getting sleep the night before an exam resulted in decreased academic performance. So knowing that sleep can affect our bodies, it's not only important for college students to pass exams, but also important in everyday life. So when sleep affects nurses' cognitive function, it decreases their ability to give their patients the care that they deserve. And informing former and current nurses how important sleep is allows the improvement for care for our patients. These are my references. And that's all. Are there any questions? Yeah.
Are you able to catch up on sleep? Like, let's say if I pull an all-nighter tonight, can I catch up on like tomorrow?
You can. Well, I found from personal experience you can, but it takes like a while for your body clock to like adjust. Yeah, because I've noticed doing my practicum night shifts, it takes a while for my body to. Because last Monday I worked, Tuesday I was up on like all night. So it's just a process. Yeah.
So, because like you just said, you work nights, and some
Mhm.
of us, we work better at night. So does it really matter when we get the 7 to 9 hours of sleep, or does it just depend on the hours of sleep?
I don't think that it matters when, as long as you're getting that 7 to 9 hours of sleep, because when you are sleeping, your body's resting, your brain is restarting. It's giving your brain just time to just, you know, reorganize. So. Oh yeah, sorry. What did you say, Alberto?
I forgot.
Me too.
Are you able to catch up on sleep?
Oh, the question was are you able to catch up on sleep if you pull an all-nighter? And then does it matter when you get the sleep as long as you're getting the hours? Because some people are night people, some people are day people. Okay.
That concludes this session.
Yes.